So it's entirely possible that you haven't heard about this Veterans Affairs Hospital in Marion, Illinois. An article written by John Holman in the Southern. 4 Illinois congressmen have voiced their displeasure with Veterans Administration officials following Monday's release of federal investigation results into 29 deaths at the VA Medical Center. The Inspector General's Office of Health Care Inspections in Washington concluded that the surgical specialty care line at Marion was in disarray. A review of 29 deaths of veteran surgical patients in fiscal year 07 indicated specific problems with the provided quality of care. These problems included preoperative, intraoperative, and postoperative issues. The Office of Healthcare Inspections also substantiated allegations of poor medical care involving 2 non-surgical patients. Quoting Dick Durbin, "While I appreciate the efforts of the Inspector General, I am disappointed that after a 5-month investigation so little has been added to the original facts and the VA is still dragging its feet. The Marion VA Center is still awaiting critical personnel decisions by the Veterans Administration, and veterans downstate are waiting the slow turn of the bureaucratic wheels at the VA to resume the services they were promised. Our veterans and their families deserve more." Congressman Jerry Costello from Belleville stated, "Our veterans deserve to know that the medical professionals that are taking care of them have been thoroughly vetted and are highly qualified." Costello stated that oversight of each VA facility is critical and that they will be working to fully inform the public about the findings of these investigations and implement much-needed changes. Congressman John Shimkus from Collinsville, "There were many people, doctors and staff, who failed in their duties, who failed the veterans in their care. The former administrative staff at Marion also withheld information from the public and from the legislators. Something like this must not be allowed to ever happen again. Those responsible will now face administrative action." And Senator Obama added, "These investigations have provided new information about failures in leadership and quality control. However, the VA must provide stronger assurances that these problems aren't occurring elsewhere, and that it has a plan to help the families who have lost loved ones." The thing that I would like to point out about all of those remarks and about this whole thing, and this has been going on for quite a while now, and I have encouraged all of the legislators involved in this to really get an outside agency, whether it be a federal prosecutor or federal prosecutor is probably the state's attorney general, whoever, to investigate this. The VA is investigating itself, basically, and they're going to minimize it. They're going to minimize it. They're going to deny problems that exist. They're going to obfuscate the evidence. They're going to manipulate the evidence. They're going to manipulate the facts. They're going to act outrageous. They're going to feign righteous indignation, and the reality is they're going to push this down to the absolute lowest level. So the people that are going to be punished are the people that are at the absolute lowest level. This surgeon, this one surgeon in particular, had his license revoked in Massachusetts before he got a license to practice in Illinois and went to work for the VA. So they do not properly and thoroughly vet, check the backgrounds, or they would have discovered that this surgeon had his license in Massachusetts revoked. The reality is, until there's criminal, and you noticed in there it said administrative action will be taken. Well, administrative action isn't enough. This merits criminal action. these people that were responsible for this need to be held accountable criminally. They need to do time in prison. And until you see that level of accountability, this is going on. This is not new. This is not an isolated incident. This has been happening for years and years and years. You can search back through the history and find all kinds of examples. The Veterans Affairs Medical Center in Columbia, Missouri, in the early 90s, same thing. Suspicious deaths, and more recently, the psychiatrist at the Tampa VA Medical Center that filed a complaint with the state of Florida because the VA wouldn't do anything. There's the list of examples just go on and on and on, and yet these people who claim to be fighting for the veterans are adamantly in denial and keep referring to these things as isolated incidents. They're not isolated incidents. It is a widespread and metastatic issue that permeates the VA. It is a culture. The problem is a culture. The culture at the VA is act like you care, but just go with the flow. Don't rock the boat. The employees and some, not all, some of the employees of the VA are excellent. They really truly do care, and they really truly do what they do because they do it for the veterans. But that's a minority. The majority of the employees are afraid to do anything because they're afraid they'll get fired. They're afraid they'll lose their job. The VA has the second highest quit rate in the entire federal government. The only agency of the federal government that has more employees quit every year is the Department of the Army. VA is number 2. VA has only the Department of the Army has more employees quit. VA is number 2. That means that out of all of the different federal agencies, the VA has the second highest number of quit rates. And it's the employees that desperately want to do the right thing by veterans that are stymied by the bureaucracy. The bureaucracy crushes their spirit. The bureaucracy crushes their motivation, and it drives them to quit. They would rather work somewhere else that is not going to subject them to the culture of don't rock the boat. So I encourage you, if these kinds of things get your blood boiling, like they do mine, check it out. Do a little research, look through the news history on this issue. The Marion, Illinois Veterans Affairs Medical Center, 29 suspicious deaths in 1 year. In fiscal year 2007, 29 suspicious deaths. That's that they're reporting. The real number, who knows? It's going to be higher than 29. The VA has claimed that no one outside of the medical center administration knew this was going on. That is a crock of shit. That is simply trying to push the blame down to the lowest level. Don't take it. Don't listen to it. Don't believe it. Contact these Illinois senators, these Illinois representatives, even if you don't live in the state, even if they're not your elected representatives, contact them. Contact them and tell them that you demand criminal accountability. Once we start seeing criminal accountability, then we'll start seeing a change in the culture. Thank you. Godspeed.